platelet disorders, they used to get me a lot. They get a lot of students because you just don't know them. You have to know how to differentiate them, okay? So, for example, all platelet disorders have increased bleeding time, all right? Mucous membrane bleeding and microhemorrhages. Interesting. Platelet counts are usually low, but maybe normal qualitative disorders. So when you get down to, for example, TTP and HUS, and I know we said before, HUS is typically children, TTP is typically females, but you need to know a little bit more, right? For example, look at this one, presentation, kind of cool, meaning it's easy points. The triad of thrombocytopenia, right? Decreased platelets, microangiopathic hemolytic anemia, and acute kidney injury. So if you realize this is shared by both, the triad, right, is shared by both. That's good to know. But the difference, though, is the kids, besides being children, there's also bloody diarrhea. In females, right, in this TTP, there's triad, same as this one, but there's fever, no fever here, neurological symptoms. This is where we fall short. And not just in this topic, in every organ system. So I'm trying to show you through examples how to be a better test taker, how to prep better in a short time frame. Because I did see a couple other posts, people getting into residency, getting upset and being feeling down because they can't keep up with family medicine or internal medicine because they had most likely they had bad study habits. They probably got walked through school, babysat through school, and then basically now they're in big leagues in residency and they can't hack it because they don't know how to really prepare. So what I take to heart is teaching you guys how to study and prep based upon what you're doing, right? Med school is one thing. This is USMLE prep. And then when you're in residency, you're going to be expected to do a lot in a short time frame. You have to be reading faster, reading better, reading more efficiently, large amounts of content, and being thorough. So something like this, you're like, well, I have two conditions in front of me. I can figure out what's similar from both and how to differentiate from each one. And then you'll be able to see that on the exam. Simple as that, guys. I hope you do that. It's going to help you. All right. All right, let's do this question. Now, a lot of you don't like micro. Some of you do. I hope you do, because micro is everywhere. Micro is going to be your best friend or your worst enemy. Either way, it's going to be everywhere. All right. So the drill. This is the chat box here. Smiley face. If you want to answer questions, chat away. If you just want to watch and listen, you're driving, be careful driving. A lot of you guys are working now, so thank you for jumping on. Point is, we're here working as a team to push forward, okay? So I usually read the last 3 lines because that's what I do. That's what I advocate because it's the best way to attack any USMLE exam or question for that matter. But you take and implement what I suggest and hopefully it works for you, right? If it doesn't, try something different. At least you're trying. Read the last 3 lines will save a lot of time. Ready? There are decreased breath sounds and inspiratory crackles over the left lower lung fields. His hemoglobin 7, low. Blood culture grows obtocin sensitive, gram positive diplo. A deficiency in which of the following is most likely contributed to this patient's infection? All of you at this stage, meaning if you study for a while, you should have an idea what this is. You should have an idea what that is, okay? Because you have some that are diplo, gram negative, and gram positive, obtocin sensitive.